You're listening to the Monday Night Community Show with Daniel on BRFM.
This is the Daniel Monday Night Community Show on demand through YouTube. Thank you very much for choosing to listen to us through this method. If you'd like to keep up to date with when I add new interviews, then subscribe to this channel. We're now going to be joined in the studio with Mandy and Claire, and it's part of the regular slot we do with the Health Visiting Team. Mandy, as always, it's great to see you, and Claire, it's good to have you along with us as well.
Thank you for letting us come along.
Yeah, thank you.
It's good to be back again.
Well, I know this time you're going to be focusing on all the aspects of breastfeeding, I understand.
Yes, we are. Obviously, we're going to hope to give you an introduction into what breastfeeding is all about, and any of the problems that you might come across, and the benefits really of breastfeeding for both mums and babies. And it's a subject that is very much up there in our sort of that we talk about a lot with mums, and I know that midwives talk about it a lot, and we hope that mums talk to each other as well about breastfeeding, but maybe we can perhaps dispel some of the myths and give some good accurate information so that people are well informed and they can make their own choices. Claire's going to start off with some of the benefits about breastfeeding and give us some idea of skin-to-skin contact, and also perhaps the role of the health visitor in supporting mums.
Okay, good evening. So, we often hear the term breast is best. There's lots of reasons why that terminology has come about. The health benefits for baby are many, including protects against risks of ear infections in babies, chest infections, and when they get quite wheezy, it's all protections against that. Also, it lowers the risk of diabetes. Babies that are breastfed are reported to have less allergic reactions to diseases like eczema, asthma, and again wheeziness. There's protection for the babies against diarrhea and gastroenteritis and stomach upsets. There's also a lot of neuro science recently with research and saying that breastfeeding actually contributes to better cognitive development, so that's the way in which the brain develops. There's better mouth formation and straighter teeth from breastfeeding, and also quite recently within the public health domain, lots of research about obesity, and breastfeeding being one of the things that we can do to lower the risk of babies becoming obese later in their childhood and throughout adolescence and into adulthood. Also, there's benefits for mum, one of which is the lower risk of ovarian cancer. This is quite important because with ovarian cancer sometimes it can be non-symptomatic, and mum might not even know that she's having any pain or any symptoms. There's also a lower risk of pre- and post-menopausal breast cancer, and also researchers showed that women that are breastfeeding have stronger bones later on in their lifetime. One of the ways in which when we're health visiting and we go out to mums, hopefully at the antenatal visit, which will be before you obviously have baby, we'd like to talk to you about ways in which that you can begin to breastfeed, to initiate it through something called skin-to-skin contact. This can happen immediately after birth. So you've had baby, maybe baby would get weighed and delivered when it's all weighed onto your chest, and you can have some naked skin against your baby's naked skin. And if this is unhurried and unlimited, and this can help calm the baby, it can steady their breathing and their heart rate. It helps to keep your baby warm and maintains their blood sugar. With the skin-to-skin contact, your bonding is beginning with your baby. And this is actually when breastfeeding can can help initiate because the baby is close to you. And the other thing that's really nice to know is that when you have the skin-to-skin contact, it can disperse baby stress hormones. So that's why baby can become calm. You automatically put baby onto your skin. It can feel your warmth, and the stress hormones that release can be decreased by just purely having that skin-to-skin contact with you. So it's really important that if you're thinking about breastfeeding, to have that conversation with your midwife. And maybe pop in your birth plan that this is what you would like to do. So once you get to hospital, you can discuss that again with the midwife that would be delivering baby, and just express your wishes so that she can have the other midwives to be able to support you after delivery to help you breastfeed your baby.
I'm going to be talking to Mandy now.
Yep. Right, well, we've talked a little bit about the benefits of breastfeeding for mum and for baby, and really one of the most important things is to get the technique right, is to actually be comfortable and start off correctly, so that the whole experience is pleasurable for both of you, and that increases that bonding. So breastfeeding is instinctive for babies. They want to do it. They show signs of actually wanting to feed from you, and we can talk a bit about those what we call cues to feeding, but also but it's something that you may have to you will have to learn, because it's not something that obviously we would necessarily do instinctively. The most important thing really is to be aware of when your baby wants to feed, and usually your baby will start to tell you, give you little signs even before they start to cry. So they'll start to move their head around, they'll raise their hand up upwards, and they will what they call root around. Their heads will go around and will go towards your chest if you're holding them, and they will open up their mouths and they will be looking ready to have a feed. And you'll also eventually they will, if you ignore those cues, they will start to exercise their lungs, and they'll be shouting for it, and they'll be crying. So when you do recognise those cues, make sure that you're in a comfortable position. Make sure you're sitting down somewhere where you're comfortable. You've got a drink of water or something nearby, that you are relaxed, and that you've got your baby, you've got everything you need around you, and that you've got a pillow perhaps to support your arm on, or your baby on if you want to, and that you're ready to start, so that you're not having to disturb yourself or the baby when they're feeding. So when you've done that and you're ready to go and you're comfortable, then just look for the signs of good attachment, and attaching the baby to the breast correctly will make it so much easier, and they will get the full feed, and you won't get any problems with your breasts. So make sure that baby's mouth is open very wide as he starts to attach. So make sure that more brown area is showing above the baby's top lip. Make sure the baby's nose is free so that he can breathe. And I think what I often say to mums is, if you think about when you take a drink of water, you put your head back when you actually swallow. You actually take a drink, and we automatically put our heads back. And sometimes if baby it doesn't have its head slightly tipping back, then they're not able to breathe properly, and so that can be a simple reason why babies struggle sometimes, or splutter and struggle to feed and to latch on. So make sure their head is slightly back, and that they can actually breathe properly. The baby's cheeks should be nice and rounded when they're feeding properly, when they've attached. And obviously the most obvious sign is that if they're attached onto your breast properly, then you're not going to feel it. It's not sore. You'll just feel that pulling sensation, but not a pain or any soreness. So their cheeks need to be nice and rounded, rather than sucking in. That the baby takes long sucks and swallows with short little pauses. They don't suck continuously. They do have little rests in between, short pauses, and it should feel comfortable. And then after day 5, you'll start to get lots of wet and dirty nappies. And I think one of the things that people worry about whether the baby's getting enough, they can't see the number of ounces or millilitres that they're drinking. You can always tell that the baby's getting enough because they're content. They come off the breast themselves after a feed, they fall asleep and they're comfortable, and they have lots of wet nappies, at least 6 in 24 hours, and they have plenty of dirty nappies as well. And also you can feel your baby getting heavier the baby grows get tighter and smaller, and you will feel yourself that your baby is getting enough. And obviously you can take them to clinic to have them weighed, but those signs are the most important signs of knowing that they are actually getting enough.
With the health visitors, and they're focusing on all the aspects of breastfeeding this evening.
So if we just chat a little bit about women's breast health while they're breastfeeding, because it's really important that you're comfortable, because if your breasts are comfortable, you're going to more likely to continue to breastfeed. So in the very first few days, or maybe the first couple of weeks, while breastfeeding is becoming established, if the latch isn't effective in the early days, you may have experience of sore, cracked nipples, but this is obviously only if the attachment isn't correct, and if you're feeding and it's actually painful, then what you need to do is just pop your little finger in the corner of baby's mouth just to release the suction and take baby off. And just as Mandy was discussing the attachment, that's actually getting baby onto breast, just to try those steps again, because actually when baby's feeding it shouldn't hurt, because once the nipple's in the mouth it's right at the back, and when it's sucking it will be against the soft, your nipple will be against their soft palate, so it won't be against the hard palate. So if it is hurting, it's pinching, and that's what's happening. So just try all the attachment again. However, if there is you do experience a sore nipple, or maybe they get cracked, you need to try to use a lanolin cream. And also you can use that, and it doesn't have to be washed off in between feeds, for example. And also you can use some of your breast milk, just express a little bit, and using a C-shaped with your thumb and your first finger, just behind the areola, and just press down just very gently, and that will release some milk. And then you can actually just dab that around your nipple, and that actually acts as a healing ointment, and that's really, really good to do that. But I would just really highlight that if you are getting pain, we'll give you the phone number for the Health Visiting Team to give you some information with peer support, because there's a lot of support out there for you, and just maybe you can go to one of the groups to have somebody help you with the attachment. Another good thing to make sure is not to use any soap, anything with like lots of perfumes, because what that is actually doing is drying out the skin, and making your nipples more prone to drying out, and therefore cracking as well. Basic things like wearing cotton bra so that the air can circulate, and when you have sore nipples, there is no need to actually stop breastfeeding at the time, but you do need to actually get that help from the breastfeeding supporters, so that your breastfeeding becomes more enjoyable, and your nipples can heal then.
We're talking to Mandy and Claire. They're focusing on all the aspects of breastfeeding at the moment.
Yes, we're talking about all aspects of breastfeeding, and there's a lot of information out there that you can get hold of. If you go to your Health Visitor Team, they will have a lot of information. There are leaflets that you can get hold of. There are helplines, for example, the National Breastfeeding Helpline. There's the National Childbirth Trust. There's all sorts of information on websites. NHS Choices has a lot of information which you can get online, and also there is information in your red book, which you will have, and your health visitor will have put lots of local phone numbers in there as well, so that you can get in touch if you have any concerns or any worries about breastfeeding at all. It's best to get the help. And I know that some of the helplines you can phone even in the middle of the night, so that you can get advice there and then to help you, to encourage you to carry on feeding. And obviously you've got the most important website, which is the baby-friendly website, which is UNICEF, and that's www.unicef.org.uk, and you'll be able to find that on BRFM's website. And in fact, if you just Google baby friendly UNICEF, you'll get all the information about breastfeeding and all the help that you need. But do feel free to ask us. I think it's important to say that breastfeeding does take commitment. It takes time. It means it does actually take a bit of time to establish. You've got to learn with baby, and it's you can't expect it to just happen, straight away in the first few days. It takes a few days before the milk actually comes in to your breasts. Those first few days you get that very healthy colostrum which comes through, the clear fluid that comes through, which is full of goodness and full of nutrition for the baby. Breastfeeding is fantastic because it's convenient, it's cheap, it's available whenever you and the baby need to be feeding, and it's something that is very portable. Obviously, you don't have to worry about bottles and sterilising and all the equipment that takes. However, we do appreciate that people do have their own choice to make, but we want to make sure that you get all the right information so that you can have an informed choice. A little bit more about some of the questions perhaps that people might ask about breastfeeding, and one of the things I wanted to mention before that was tongue tie. Now, when your health visitor comes to see you for your new birth visit, she will ask you about tongue tie and ask whether the baby is latching on and whether there's a good vacuum when baby attaches. And sometimes when babies don't attach properly to the breast, it could be that their tongue is a little bit tight in their mouth, and this can be very, very easily remedied and sorted out, and you need to contact your GP, and again your health visitor can advise on that as well, and she will have a look to see how the tongue is if baby is not attaching properly. Some of the other questions that people might ask: how often will my baby breastfeed? Well, we talk about feeding on demand, and feeding on demand is about looking at those cues that babies give you to your feeding, and giving the breast when they want it, but also planning later on as you get more established. You'll be able to plan when to feed your baby so that it can be convenient for you as well. So it's on demand for you and on demand for baby. And usually we talked about those cues, and usually in the initial stages you might feel that the baby's always on your breast, but that's really them getting established in the feeding. So that's important. How long should each breastfeed last? Well, obviously babies vary, like we do with our appetites, and babies only have tiny little stomachs about the size of a walnut, so that they can't take a lot of volume straight away, and they therefore need to feed little and often. And one of the benefits of breastfeeding is that it does actually help to reduce the risk of sudden infant death, cot death, which we talked about on the last show that we were on, and that's important that babies do wake up and they do feed. So that frequent feeding is something that is very, very good for them, and it's very important that they do that. You will find that you will be tired, and you will find that it's just you and baby, but that's the sort of bubble that you need to be in for the first few weeks so that you get this feeding established. Then things will start to get into a bit more of a regular pattern, and then those few early days will seem a long distant memory, but that's really good for baby. If you have more than one baby, if you're lucky to have twins, then of course you can feed both babies, and you can feed both babies at once. There is support for that. Again, your health visitors can help support you in breastfeeding more than one baby to get them into a routine, and also you can breastfeed after a cesarean as well. It's very important that you get that skin-to-skin contact straight after the birth so that it stimulates your brain to tell your breast to produce that milk, and so make sure that even if you have a cesarean, that the baby comes onto your chest as soon as possible for that very important first few moments of skin to skin. And obviously breastfeeding, you'll have to make sure that you're nice and comfortable if you have a scar, and that you're in the right position so that it works for both of you. Storing breast milk is very good. If you do go back to work and you want to store milk and express, again, you can get advice and guidance on that as well. And that storing breast milk is good. It can be stored in the freezer. It can be stored in the fridge, and you can leave it out longer in the room as well, in a bottle if you need to. But again, those are things that you can discuss when you get to thinking about perhaps going back to work and being a bit more, or maybe your partner might want to take some of the feeding as well. But in certainly the first 6 weeks, it's important not to introduce anything other than the breast. No teats, no bottles, if at all possible, and then the establishing of breastfeeding is a lot quicker and a lot better.
I think we're going to be talking back with Clare next.
So through talking to some of my mums, one of their concerns is, going out and feeding in public. Well, what we've spoken about today and all the benefits and everything, that is a great advantage of breastfeeding, is that you can do it anywhere, whenever you want to. You're not worrying about making up bottles, finding somewhere that you can heat them up, waiting for baby to get over fussy. It's there and it's ready and it's available. So one of the things I just wanted to discuss is for women to have confidence in, if you're going to a cafe or you're going anywhere to feed, to know that, that is your right to be able to feed your child, wherever you want to feed them. And you shouldn't ever be told, to go to the toilet, for example, to feed your baby, because sometimes people might try to direct you in the baby changing room. Well, actually, that's a toilet and a changing room for a baby, not where you would want to eat your lunch, and you certainly wouldn't want to sit on the toilet and feed your baby. So it's just knowing really that you have that right to be able to feed your baby wherever you would want to, and to challenge that and maybe ask to speak to the managers, and just so that that you are able to feed where you want to, where you feel comfortable as well. There are different products and bits and pieces. You have muslin squares that you could possibly just in the first, maybe the first month or so, when you're still getting to grips with the old practicalities of the nursing bar and bits and pieces like that. But as your breastfeeding becomes more and more established, you'll be able to do it so discreetly, and there'll never be a situation where you're actually getting your whole breast out and then popping baby on. And hey, if you ever were, you're still feeding your baby, and I want you to, be just so confident that you're able to do that, because if somebody doesn't want to look at a mum and a baby breastfeeding, they are able to turn away. So just to have that confidence to be able to do that for you or baby.
Okay, so really we're coming to the end of our time tonight, and we've only given really an introduction to breastfeeding, and it's something that we'll probably come back to in the next few months, so that we keep it sort of up there on the top of our agenda, because it is definitely the best for our babies. But so we've talked a lot about attachment. We've talked a lot about how to get the breastfeeding established, the benefits for mum and baby. Some of the problems can there are difficulties. Some mums have difficulties, and some mums can have blocked milk ducts or mastitis or problems of cracked nipples, and all of those can be resolved very simply. And we can spend more time in your home, giving you advice and actually helping to resolve those problems. And they don't happen with everybody. They are problems that come up rarely. So we've talked a lot about feeding more than one baby, which you can do. Again, you would need some specialist advice probably to help you establish that. And that we've let you know that there is lots of information out there for you to read. Lots of websites, lots of leaflets, and lots of research out there for you to look at, to see exactly what it is that you're doing and how good it is for your baby. So we hope that we've covered most of the bits and pieces that you need to know before about breastfeeding. It's important to have that information so you can make that choice, and it is important to talk to people. And if you are breastfeeding, well done, and keep it up, because it's the best thing you could ever do.
Well, Mandy and Clare, I'd like to thank you very much for coming along, as always, on our regular slot.
Thank you. Oh, can I give the phone number for the Health Visitors? And obviously, I'll give the phone number for the Swale team, because that's where we are, and it's 01795 433 950. So it's 01795 433 950.
And I've no doubt we're speaking to Mandy and another colleague with another theme in 6 weeks or so time, right here at the Monday Night Community Show.
Oh, we really do play that essential mix of music.
BRFM Sheppey 95.6 and online.